Hello, my name is David Hatfield with the Hatfield Medical Group, and I'm a board-certified family practitioner. My dad originally started Hatfield Medical Group back in the 1960s. I watched him practice family medicine, and I gained a love for what he did and how he took care of patients, and I wanted to follow in his footsteps. And so here I am, 25 years later, practicing in the same office that he ended his career in. I think that the most important thing is for patients to know how much you actually care about them. And when they know that you care about them, they'll care how much you actually know about their health care, whether it might be high blood pressure, diabetes, or helping them quit smoking. At the end of the day, we're trying to help them navigate to better health and quality of life. And so as we take time to get to know them, they'll listen to us and we'll be able to form a teamwork approach in helping them improve their health.
Hello, so my name is Charina Texan and I am an internal medicine physician, so I have been in practice for the last 22 years. Okay, so most of my patients say that I'm very thorough. I want to look at all aspects of their health. I'm very particular about if they are taking their medications and if they are engaged in their care. Because as a physician, I need their help to manage their medical conditions. So I think they appreciate that I listen to them and then, ask their opinion as to how they can help me manage their chronic medical conditions. It's that relationship. Okay, I think in doctor-patient, the most important thing is having a good relationship with your patient and open communication. So if you have an open communication where the patients feel that you are listening to them, then they will keep on coming back, and that's the reason why they stay with you for a longer period of time.
Hello, my name is Tamara Waldron, and I'm a PA here at Hatfield Medical Group. I've been practicing at this location for 7 years now and have been in medicine for a total of 12 years. That's one of the things that's so important with our patients is the consistency. I've been here for over 7 years, and I have quite a few of my patients that I've seen that entire time. And when you build that relationship with your patients and you see them for a long period of time, not only do you build that relationship and that trust so that they're willing to tell me things that they might not have told a different provider or someone that they hadn't known as long. And so when you start seeing patients consistently all the time, it's much easier to figure out, okay, what's going on and what's changed since the last time. Part of that comes from my mathematical background. I taught high school math for about 10 years. Most recently over here at Westwood High School. And that's what math is. It's figuring it out. Having all of the different parts and trying to figure out how they fit together and coming up with the picture afterwards.
My name is Tyler Dennison. I'm a physician assistant for Hatfield Medical Group. I've been a physician assistant for the last 14 years. I've been with Hatfield Medical for the last 11 years. Every time I see a patient, I have to understand everything that's going on with that patient. So I'll go back and I'll review past notes, the last several notes. I'll review the communication that's been between each patient, every medication that they're on, everything they've been diagnosed with, their last blood work. It's a process and it's a lot of work, but really when I walk in that door and I can talk to them about their last blood work, and I can talk to them about how their last visit went, how the phone call went with the medical assistant, or the communication back and forth. They're impressed. They're impressed that I know what's going on, and they love that. They love that I've taken an active role in understanding their care.
My name is Dr. Donald Griner. I have been practicing medicine for approximately 35 years, born and raised here in Mesa, Arizona, and I'm currently at the Hatfield Paragon facility. I've been practicing medicine overall about 35 years. I have some real long-term relationship with families, and I know their situations. I know about the death of a husband or a wife and family conditions, and we touch bases with that when we see the patient. And they do appreciate that because I care about them and their families and their situation, and it puts them much more at ease, and they respond better to treatment. Preventative care to me means anticipating problems and preventing them. I like the simile of a fence at the top of the cliff instead of an ambulance at the bottom of the cliff. That's always much more favorable. And it helps the patients avoid avoidable problems and stay healthy and happy and avoid unnecessary expenses to them or the system.
My name is Daniel Ramos. I'm a PA here at Hatfield Medical Group. I've been practicing here in the East Valley for the past 9 years, and I work here at the Apache Junction location. My patients really appreciate the time I take with them at their appointments. Sometimes it can be frustrating to have 2-3 minutes of face-to-face time with a specialist, but we really try to take a lot of time with our patients here at Hatfield Medical Group. We intentionally limit our patients per hour to 3 an hour so we can have that extra time. When I was going through college, I really wanted to do engineering, and that was the route I was going into. Then I had an issue myself where I had to end up getting back surgery and had a significant recovery process. So that really changed the way I felt about how I wanted to proceed with my career. So I had a significant change in my life, and I saw the power of medicine and the significant turnaround that I had in my life, and that made me really want to go into medicine to help other people.
My name is Scarlett White. I'm a physician assistant here at Hatfield Medical Group, and I have been a PA for 2 years. I feel like my patients come back and see me because they feel like we have a personal relationship. I spend a lot of time in the room with them. I address a lot of their concerns, and I think they feel that I care about them as a person, as an individual. I mean, it's important to address those conditions that they're coming in for, and I do feel happy and accomplished that I've done my job to help the patients, and it is rewarding whenever you see them smiling or happy that they were able to achieve that goal that we have been working on for so long.
My name is Marianne Moyer. I'm a family nurse practitioner. I've been a family nurse practitioner for the last 8 years, and I've been a nurse since 1997. I feel primary care is very important because I feel that we look at the whole patient in a holistic manner. I feel that we are able as providers to be able to have relationships with individuals. Continuity of care as the same provider, knowing you, understanding you. When patients come in, I know their name. When they call, I know who they are. I know their background. I think it's very important as a nurse to ask questions and to find out what their needs are, and to approach each patient differently because we all come from a different place.